Hello, my name is Fergal Malone. I'm an obstetrician at the Rotunda Hospital, Dublin. A UTI is a urinary tract infection, which is caused by bacteria getting into the urine and then irritating either the wall of the bladder, which is cystitis, or the kidney itself, which is pyelonephritis, much more serious. The most common symptom of a UTI is urinary frequency, going to the bathroom too often. Also, common symptoms would be dysuria, which is stinging or burning when you urinate. There can also be a foul smell from the urine. There can be a fever, a temperature over 38 degrees, or sometimes if it's a serious infection in the kidney, there might also be back pain. Because some of the symptoms, such as going to the bathroom very often, are common, it probably makes sense to wait until there's at least a couple of symptoms of a urinary tract infection before seeking medical help. For example, a combination of going to the bathroom too frequently and stinging or burning when you urinate. Usually the combination of those symptoms is quite suggestive of a urinary tract infection, and in that situation you should attend your GP for a very simple test of the urine to check whether or not an infection is present. One of the more common causes of a urinary tract infection is overfilling of the bladder or not emptying the bladder regularly. If the bladder is overfilled, it's more likely that you can get an infection there. Sometimes poor personal hygiene habits, such as how you wipe yourself after going to the bathroom, can also cause a urinary tract infection. It's important to wipe from front to back, not from back to front. Sometimes urinary tract infections can occur after sex, which is why it's also a good idea to empty the bladder soon after having sex. There are certain risk factors that make urinary tract infections a little bit more common. For example, if you've had bladder surgery or problems with your kidneys in the past, or a history of having recurrent urinary tract infections, then they are unfortunately going to be more likely to happen again. Sometimes not keeping yourself well hydrated can lead to urinary tract infections. It's important to keep the kidneys and the bladder flushed out as much as possible by drinking a lot and making sure you empty the bladder frequently. It's possible that UTIs are ignored by some women because of an embarrassment or a difficulty in talking to their healthcare professional, their doctor, their GP practice nurse about the symptoms. There may be a sense that these are normal symptoms, and while it is normal to periodically have frequency of urination, it's not normal to have a combination of frequency of urination plus stinging or burning when you urinate. So I think there can be a combination of lack of insight into what's going on and also potential embarrassment about talking about these problems to either your GP or your healthcare professional.